Why is healthcare the greatest social responsibility? Because it directly impacts every living person, from first breath to last. It's inescapable. So what do you think when you hear the word healthcare? I want to expand your understanding of that word. But first, you must assume a miracle. A genius has provided a perfect solution for how to pay for health care after the fact. Obamacare, Clinton Care, Medicare, Medicaid, insured, uninsured, VA, Native American. Did I miss anyone? That problem has been finally set aside. And attention can be directed toward your and your loved one's healthcare delivery system, doctors and hospitals. Our nation has the greatest healthcare delivery system in the world. The vast majority of all medical care is acceptable, and much of it is exceptional. But when individual patient care falls beneath an acceptable standard of care, that's where our current healthcare delivery system fails the public and has always failed the public. Example, some experts have suggested that medical errors are the third leading cause of death behind heart disease and cancer. Sadly, there's not one person in the nation that knows for sure if medical errors are the third leading cause of death, or the fifth leading cause of death, or the seventh leading cause of death, because our current healthcare delivery system has never been able to provide those critical statistics. So, what lies to the problem here? Our nation has a vast army of quality of care experts that is made up of multiple components: medical professional organizations, think tanks, foundations, schools of public health, private organizations. But the core of that army of experts has been 5 federal agencies created and funded by Congress for the last 5 decades. The first was created in 1970, the second in 1987, the third got up and running in 1990, the fourth in 1999, and the latest one in 2010. So that's collectively about 140 years of effort to improve the quality of care and patient safety, and their track record reads: some have suggested medical errors are the third leading cause of death. Another example, in 1990, after 4 years of research, a team of experts from the Harvard School of Public Health estimated there were 98,000 needless hospital deaths annually. That's the equivalent of 268 people dying each day, every day. Well, 10 years later, in 2000, the Institute of Medicine published a book, To Err is Human. And in the early pages of that book, they stated, we have everything we need to reduce that number, 98,000, by 50% in 5 years. Sadly, that's not what happened. 6 years later, another estimate was double that 98,000, and 7 years later, in 2013, the latest estimate was far greater. So their track record reads: are medical errors the third leading cause of death? And why has every new estimate of needless hospital deaths been greater than all previous estimates for the last 29 years? Well, clearly, something has been missing in all of those efforts, and that something is states. States are responsible to create and maintain an effective healthcare delivery system, and none of the efforts the last 5 decades have ever focused on the state responsibility. Why are states responsible? Well, there are two fundamental facts. First fact, all medical care is local. If you get sick or injured near where you live, or if you get sick or injured in one of the other 49 states, you're going to get local medical care. Second fact, states license doctors, hospitals, and surgery centers. Those two facts demonstrate each state's responsibility, but no one has focused on that state responsibility. Early this year, the U.S. Department of Education published a report, and the first 5 words in that report are, states are responsible for education. What we need is for people in Washington, D.C., and people in the 50 state capitals to recognize that in order to improve the quality of care and patient safety, you must look to the states to create a 21st century healthcare delivery system. So I have an offer for any governor. I can provide a logical and doable process on how to begin to create a 21st century healthcare delivery system for the citizens of your state. And if interested, please contact me.